Picture this. It's 2 a.m. and a 16-year-old male wakes up with the worst pain of his life in his testicle. He doesn't wake his parents. He's embarrassed. He waits. He Googles it at 3 a.m. and convinces himself it's probably just a muscle thing. By morning, the pain has eased up a bit. See, he thinks, I'm fine. He is not fine. This scenario, some version of it, plays out in emergency departments constantly. And the delay, that's the dangerous part. Today, we're talking about testicular torsion. Yes, we're going there, because this condition can permanently damage or destroy a testicle in a matter of hours. And most people have literally never heard of it. Quick note before we dive in, I'm an emergency physician, and this channel is all about translating what I see in the ER every day into plain English. No jargon, just the stuff you actually need to know. If that sounds useful, hit subscribe. Let's get into it. Okay, here's the setup. Your testicle doesn't just float freely in there. It hangs from a structure called the spermatic cord, and it carries its blood supply. Think of it like a garden hose attached to the top of a water balloon. The hose delivers the water. Cut off the hose, the balloon is in serious trouble. Now, most people have some tissue anchoring the testicle in place so that it can't really spin. But some men are born with a variation where the testicle isn't anchored securely. It can rotate more freely. And when it rotates, the cord twists. Blood flow slows or stops. That's torsion. Twisted cord, no blood, testicle in crisis. Here's the kicker. This can happen during exercise, during sports, after a minor bump, or here's the fun one, during sleep. You can literally just be lying there sleeping and your body just decides it's time for chaos. Let me tell you about the patterns I see in the ED because they're almost always the same story. Story 1. A teenager wakes up at night in pain. He waits until morning. By the time he gets to us, it's been over 12 hours. The testicle doesn't make it. Story 2. A college athlete takes a hit during a game. Pain, nausea, the whole thing. He assumes it's just a sports injury because, honestly, of course he'd assume that. He ices it and waits. Comes in the next day, same outcome. Story 3. An adult male has severe one-sided pain. He waits 2 days because, and I hear this version constantly, I didn't want to make a big deal out of it. Those are not fun conversations to have. The common thread is waiting. And I get it, it's embarrassing. It's an awkward thing to explain. But I want to tell you something directly. Every emergency physician has had this conversation so many times that it is genuinely, completely, 0% awkward from our side. We are not there to judge, we're there to help. And in this case, help has a pretty strict time window. So what does it actually feel like? Here's what to watch for. 1. Sudden, severe pain on one side. Not a slow ache that builds over a day, sudden, sharp, one side. This is the big one. 2. Nausea or vomiting alongside the pain. This combo is a major red flag. Your body is reacting to something serious happening internally. 3. Swelling on that side. The area gets bigger and more tender. 4. The testicle looks like it's sitting higher than usual. The twisting can pull it upward. Yes, that's a real thing you can notice. 5. Waking up in the middle of the night with sudden pain. This one is huge, especially for teenagers. Night onset testicular pain is an emergency department situation. Right now, not in the morning. Okay, here's the part that sounds like a cruel joke. Sometimes the pain just goes away on its own. The testicle twists, causing agonizing pain, then untwists itself, and you feel better, which makes you think, great, crisis averted, moving on with my life. Do not move on with your life. A testicle that has twisted once has proven it can do it again. and the next time, it might not untwist. That's called intermittent torsion. It's real, it happens, and the "I'm fine now" feeling is misleading. If you have that kind of episode, severe pain that just disappears, you should still see a urologist. The anatomy that caused it is still there. So you show up at the emergency department. Here's what actually happens, because I think demystifying this part helps people actually come in. The triage team takes this seriously immediately. You are not sitting in a waiting room for 3 hours while the doctor treats a sprained ankle. Testicular pain is time sensitive and the ER staff knows it. A doctor will ask, when did it start? Did it come on suddenly? Which side? Any nausea? And any history of this before. Then there's a quick physical exam. Yes, that part happens. But here's what you get out of it. There's a specific physical sign called the cremasteric reflex that gives us meaningful information right away. It's quick, it's diagnostic, and it matters. If the picture is still unclear, we'll do an ultrasound, specifically to look at the blood flow to the testicle. But here is the rule that every emergency physician lives by. If we strongly suspect torsion, we don't wait for imaging. We call the urologist and we go. Because every minute spent scheduling a scan is a minute without blood flow to a testicle. Let me give you the numbers because they make this very concrete. Within 6 hours, you have a roughly 90 to 100% chance of saving the testicle. Within 12 to 24 hours, that drops to about 50%. And after 24 hours, less than 10 to 20%. We go from almost certainly fine to less than 1 in 5, not over weeks, not over days, over hours. Surgery untwists the cord, restores blood flow, and stitches the testicle in place so it can't happen again. 3 things I want you to take away from this video. 1. Sudden, severe, one-sided testicular pain, especially with nausea, is an emergency department situation. Not urgent care, not let's see how it feels in the morning, emergency department. 2. If the pain suddenly gets better, that doesn't mean you're okay. See a urologist. And 3, time is everything. 6 hours is the window where outcomes are genuinely good. Every hour after that changes the math. If you have a son, a student, a partner, a friend, share this video with them. Because this is one of those things where knowing it exists before you're in the middle of it is the difference between a terrifying ER night with a good outcome versus one without. This is not rare. It happens every single day in emergency departments everywhere. The only reason it stays a secret is because it's uncomfortable to talk about. So, now you know. Please remember, this video is for education, not personal medical advice. If you or someone you know is experiencing sudden testicular pain right now, please go to the emergency department. If this video helped, like it, subscribe, and share it with someone who needs to see it. As always, stay prepared, not scared.